So what happens to breast implants after 20 years? Well, the answers vary. If you go back 50 years ago, if you look at those breast implants 20 years later, they tended to break down and there were problems with them. Although I had a patient who was 50 years after her breast augmentation and she still had her implants. So not all of them had problems. But typically, as we start getting up to 20 years, breast implants, the outer shell containing the silicone, may tend to break a bit. And if it does, the implant simply needs to be removed. How would you know that? Well, we say that about every 5 years you should be having an MRI or an ultrasound just to assess what's going on with your implant. And even if it should be leaking and need to be replaced, the good news is that that silicone is contained within the scar tissue. It's not going anywhere. And certainly the most recent generation of implants, which we're using nowadays, not only do they wrinkle less, ripple less, but the shell tends to hold up very, very, very well with time. So with these implants, we're expecting very, very, very few leaks. But every 5 years, have an MRI, have an ultrasound just to check on things.